What is a Medicare Supplement Policy, or otherwise known as a Medigap policy? A Medigap policy is private health insurance that helps supplement original Medicare. This means it helps pay much of the original care costs that original Medicare doesn't cover, like co-payments, co-insurance, and deductibles. These are gaps in Medicare coverage. In the event you have original Medicare and a Medigap policy, Medicare will pay its share of the Medicare-approved amounts for your health care expenses. Then your Medigap policy pays its share. A Medigap policy is different from a Medicare benefit plan, like an HMO or a PPO, since those plans are methods to get Medicare advantages, while a Medigap policy only supplements the cost of your original Medicare benefits. Please note, Medicare doesn't pay any of your costs for a Medigap policy, as many may suggest. All Medigap policies must follow federal and state laws, developed guidelines to shield you from predators, and policies must be clearly identified as Medicare Supplement Insurance. Medigap insurance companies offer policies in most states that only sell you a standardized Medigap policy identified by letters A by means of N. Each standardized Medigap policy must offer the same basic positive aspects, no matter which insurance company sells it. And please note, price is more often than not the only difference between Medigap policies with the same letter sold by different insurance businesses. Let's talk about what Medigap policies cover. What do I need to know if I'd like to order a Medigap policy? Well, first of all, you must have Medicare Part A and Part B to get a Medigap policy. If you have a Medicare Advantage plan like an HMO or PPO but are planning to return to the original Medicare, you can apply for a Medigap policy before your coverage ends. The Medigap insurer can sell it to you as long as you're leaving the plan. Be sure to ask that the new Medigap policy begins no later than when your Medicare benefit plan enrollment ends so that you'll have continuous coverage. Medigap plans E, H, I, and J are no longer for sale, yet you can generally keep these plans if you already have them. You pay the private insurance company a monthly premium for your Medigap policy in addition to the monthly Part B premium you pay to Medicare that is taken from your Social Security payment. A Medigap policy only addresses one individual. Should you and your spouse both need Medigap coverage, you each are obligated to acquire separate Medigap policies. When you have your Medigap open enrollment period, you could purchase a Medigap policy from any insurance company that's licensed within your state. If you need to drop your Medigap policy, write your insurance company to cancel the policy and be sure to confirm it's been canceled. Please know that your agent cannot cancel the policy for you. Any standardized Medigap policy is guaranteed renewable even if you have pre-existing health problems. And please note, this implies the insurance company cannot cancel your Medigap policy as long as you pay the premium. Also important is different insurance firms could charge different premiums for the same exact policy. So as you're shopping the market for a policy, please make sure you're comparing the same policy. For instance, compare Plan A from one company with Plan A from another company. Some states may have laws that can offer you supplementary protections. Be sure to ask your agent for details. And although many Medigap policies sold in the past handle prescription drugs, Medigap policies sold after January 1st, 2006 aren't allowed to include prescription drug coverage. If you need prescription drug coverage, you can join a Medicare prescription drug plan, Part D, offered by private insurers approved by Medicare. To learn about Medicare prescription drug coverage, visit medicare-pros.com or call toll-free 844-7-MED-PROS. That's 844-763-3776. You might be wondering, when is the best time to purchase a Medigap policy? Well, the most advantageous time to get a Medigap policy is during your Medigap open enrollment period. This period lasts for 6 months and begins on the first day of the month in which you're turning 65 or older and enrolled in Medicare Part B. A number of states have additional open enrollment periods, which includes those for individuals under 65. Your agent should know if you are in one of these states. Please note, throughout this period, an insurance company cannot use medical underwriting. This prevents the insurance company from doing any of the following things because of your health challenges. Number 1, refusing to sell you any Medigap policy it offers. Or number 2, charging you more for a Medigap policy than they charge someone without the same health issues. Know what's up. Who is MedicarePros.com? With over 40 years of combined experience, Medicare Pros is one of the top enrollment centers in the country for Medicare supplemental solutions. We are an independent brokerage, so you can feel confident that we do not favor one insurance company over another. Our main focus is to help you to find the best plan for you. How do you get started? It's easy. Call toll-free 844-7-MED-PROS. That number again is 844-763-3776. Call now to speak to a Medicare expert. Medicare Pros has contracted with the top Medicare supplement carriers in the country to provide you with the easiest starting place to meet your Medicare needs. We will do the shopping for you and present you with the best policy for your individual situation.